Welcome to the MD Edge Daily News for Wednesday, September 5th. I'm your host, Nick Andrews.
And I'm MD Edge editor Mary Ellen Schneider. Today, new guidelines on opioid-induced constipation.
Also today, a self-management intervention for epilepsy improves functioning and quality of life.
And later, fewer enrollees reach the Medicare drug donut hole.
But we begin today with alcohol and non-alcoholic fatty liver disease. Patients with non-alcoholic fatty liver disease who consumed modest quantities of alcohol had significantly less improvement in steatosis and significantly lower odds of resolution of non-alcoholic steatohepatitis, or NASH, compared with non-drinkers. This is according to the results of a longitudinal cohort study published in Clinical Gastroenterology and Hepatology. The researchers also report that modest drinkers had significantly less improvement in their AST levels compared with non-drinkers. In the study, 285 participants were included. In all, 59% reported consuming up to 2 drinks per day, while the rest abstained. During an average 47 months between biopsies, non-drinkers averaged nearly 0.2 points higher in reduction grade compared with modest drinkers. These data achieved statistical significance. The researchers note that previously published data suggest modest drinkers with non-alcoholic fatty liver disease have less severe histology, and they tend to be more physically active and have a lower BMI. Dr. Viral Ajmera is a researcher at the University of California, San Diego. Dr. Ajmera says that the presence of NASH has consistently been shown to predict increased risk for fibrosis progression, and therefore, the finding of less NASH resolution among consistent modest drinkers is clinically relevant.
For patients with suspected opioid-induced constipation, start by taking a careful history of defecation and dietary patterns, stool consistency, incomplete evacuation, and alarm symptoms such as bloody stools or weight loss. These are among the recommendations in new guidelines from the American Gastroenterological Association published in the September issue of Gastroenterology. The guidelines further state that clinicians should rule out other causes of constipation, from pelvic outlet dysfunction to mechanical obstruction. The guidelines were written by Dr. Seth Crockett and his colleagues. Dr. Crockett is an assistant professor of medicine at the University of North Carolina at Chapel Hill. In previously published research, between 40 and 80% of patients who received opioids developed opioid-induced constipation. This more severe presentation involves a combination of reduced stool frequency in addition to other symptoms such as harder stools, new or worsening straining during defecation, and a sense of incomplete rectal evacuation. The guidelines call for starting with lifestyle changes or opioid switching. When that doesn't work, try conventional laxative therapies. Before deeming anyone laxative refractory, make sure the patient has had an adequate trial of at least 2 classes of laxatives administered on a regular schedule. You can read more about the new AGA guidelines for opioid-induced constipation by clicking the link in the podcast description.
Self-management of epilepsy using a group format remote intervention improved mood, quality of life, and health functioning in high-risk individuals. This is according to the results of a randomized controlled trial published in Epilepsia. In the trial, 120 patients with epilepsy who had experienced at least one epilepsy-related health event in the previous 6 months were randomly assigned to either a waitlist control group or a novel self-management intervention. Over the 6-month follow-up period, researchers found that patients who were in the intervention group had a mean of 10 fewer negative health events, while patients in the control group had a mean of 2 fewer events. The researchers also report significant improvements in participants' self-rated depressive symptom severity, observer-rated depressive symptom severity, quality of life, and health functioning compared with patients in the control group. More than 94% of patients said the intervention was useful, and that it covered the most important issues for them, and nearly just as many believed that the benefits of the intervention were worth the hassle of taking part. Dr. Martha Sajatovich is a researcher at Case Western Reserve University in Cleveland. Dr. Sajatovich says that it is possible that SMART may help to alleviate some of the factors that prevent people with epilepsy from optimizing their quality of life.
And finally today, more than 5 million Medicare Part D enrollees without low-income subsidies reached the coverage gap known as the donut hole in 2016. And as a result, they spent almost $1,600 out of pocket for prescription drugs. This is according to a new report from the Kaiser Family Foundation. Those enrollees represented a reversal from the rising number of people reaching the coverage gap over the last 3 years. The number of Part D enrollees without low-income subsidies had been rising from 2013 to 2015, after being fairly stable between 2007 and 2012. However, a proposal from the Trump administration to exclude the manufacturer discount from the calculation of out-of-pocket spending would both hike up Part D enrollees' out-of-pocket costs and lead to fewer enrollees qualifying for catastrophic coverage, according to the report. And that concludes the MD Edge Daily News for Wednesday. You can find links to these stories, including more data and sources, by clicking the link in the description. I'm MD Edge editor Mary Ellen Schneider.
And I'm Nick Andrews. The MD Edge Daily News is on Amazon Alexa, so you can listen to today's top clinical news using just the sound of your voice.